I see patients on a daily basis who are missing multiple teeth in their mouth. And when we consult with those patients, we take a look at all of the surrounding bone and soft tissue, and typically there's a significant deficiency in that bone and soft tissue. It's important to rebuild that bone and soft tissue so that patients can have a stable, healthy, long-lasting dental implant restoration. Typically that involves either rebuilding the vertical height and width of the existing bone with either onlay grafts or things like a sinus lift or guided tissue regeneration to basically maximize the volume of bone in preparation for rebuilding with either implants or a removable prosthesis. It's very important that we provide those long-lasting solutions to our patients for the rest of their lives, and they're confident and comfortable knowing that they're going to have the best care possible after full mouth reconstruction.